Cheers.
Cheers.
With our
ice cold water.
Coffee and childbirth because it's hot.
It's 100 degrees here.
Welcome to Coffee and Childbirth.
I'm Dr. Rhee.
Yes. Sorry. No, that's okay.
I'm Dr. Rhee, chiropractor, pediatrics and pregnancy, or I should say children. Women and children exclusively. So I'm Dr. Rhee. And
I'm Dr. Kelsey. I'm making sure my mic isn't like scratched. I'm Dr. Kelsey. I'm a physical therapist working with women and children, birth to 5. When we hit kindergarten, I usually say, go see my really fun friend instead of I'm like kind of lame to you now. And so we just transition
You're
over.
Never lame,
I'm
Dr.
not,
Kelsey.
I'm not lame, but and we are going to talk about
our mascot.
Yeah, our mascot. She doesn't want to, which is probably good. She's not like barking at us. And we're going to talk about diastasis or DR or diastasis.
Diastasis. That's how I learned it. Diastasis Recti.
Mm-hmm.
I think it sounds more fancy.
I usually shorten it to DR. I say it once in a clinic in like a session. Yeah. And then from then on, I say DR for the next hour. Because they're not listening. Once we identify we're both talking about the same thing, I'm like, let's
skip the whole word. Yeah. And let's go to initial. Is that what you're saying?
Yeah.
Okay.
Yeah.
All right. But DR it is then.
Do you feel like you see that, like that comes up a lot from clients as a question, or?
Well, let's talk about what it is first then really quick, just in case, some may not know what that is.
Sure.
Our pre-pregnancy baby moms, right?
I know, blissfully unaware.
Yeah, unaware. So diastasis is or DR is actually, simply put, a separation of the abdominal tissue, right? Mm-hmm. So the abs that we see, because we all have them, we may not see them
on paper. It's like this middle. It's like your middle portion.
That middle portion. So the abs are here, the 6-pack or 8-packs that people have, and then the actual fibrous tissue, which is what probably is that more like fascia tissue. There's some fascia tissue, some what's happening? Where you go?
I think she's off.
Are you uncomfortable?
I think she saw people walk by.
Okay, just sit down. We're talking about diastasis. Can you sit down, please?
She's like,
you're gonna rip mine.
She's like, showing me.
So yes, showing me. So this is so we have abs, right? And then we have like 6-packs,
right?
Or 8-packs for some.
Sure.
Well, actually, technically, we have all 8. We just matter of showing it or not.
Yes.
I don't think I've ever seen mine, but
never in my entire life.
But there's a line of tissue that separates the left and the right, and that tissue is like a nice, beautiful, thin sheet that just kind of gets overlaid, and it's like a combination of tendons and fascia tissue, right?
Yep. So it's collagen based. So
and then what happens with some of our pregnant moms? Not all, right? I wouldn't say it's all pregnancy, but a lot of our pregnant moms, once the belly is enlarged and getting obviously heavier and protruding forward, then it can not so much rip in a way. I hate that word.
Definitely wouldn't.
Yeah, I wouldn't say not rip. It's just separates.
We already talk about tearing,
right?
So
correct.
I usually
What's the word that you like to use? Because I just say usually
separates. Yes, I'm with you on the tissue that it's made up of.
Yeah.
Collagen. Yeah. 2 types of collagen that are slow or fast reacting. So what I usually say is that's always there. When you're a baby, that's there. When you are an adult, that's there. That it's not that the tissue is being added or anything like that. Right. So it's always present, like you were saying. But what happens at the point where you're at right now, where the muscles are stretching to the side, is that it's little micro stretches, and it becomes a little more like elastic in pants that you've worn for a very, very long time.
Yes, that's a good example.
And that elastic starts to just not hold the same way that it did when you got those skinny jeans with spandex and elastic on that first day from Old Navy.
Right.
And you're like, why is it not fitting the same way that it did? So, like you said, this is happening in pregnancy, and then you're your intestines, all the organs are pushing forward.
Right.
Baby is pushing them. Baby is getting bigger, pushing forward. And you start to notice that, the elastic is not coming back. Right. It just kind of stays open or stretched, gets thinner. Yep. When you're doing certain things.
Do you think at some point it frays a little bit almost?
That's a good question. So
sometimes I wonder.
I think it gets floppier, which is also not a great
because of the laxity that's happening, right?
Because of the
relaxin
I think
hormones
I think the elasticity is making that tissue wavier, like floppier, more stretchy. And so when you push on it from the outside, you're like, it's not there. Right. It's gone. Yeah. It's there. It's just underneath. Yeah. Does that
it almost gets sucked. It almost gets sucked from the inside.
Right.
Because
when you're
pushing
down, it's gonna go underneath, right? Because you're pushing against it. Yeah. Then when the organs are pushing from the inside out, then it comes up. So either way, it's just reacting instead of holding back against this. So it's kind of like a bridge where the tensile strength or the strength has to respond to if you're pushing down or if you're pushing out. Yeah. So that's usually why I try to say everyone has that, because a lot of times moms are like, I'm losing it. And I'm like, well, you're not really losing it. Yeah. It's just changing dramatically to fit what you need at this point. Right. So that's what it is. It's that, I always say, like you said, it's a stretch. And then very, very, very elastic. It's that loss of that true strength to bounce.
The integrity of the tissue.
The integrity of it. Like I said, like your favorite pair of jeans that don't have the same stretch as they did anymore. Snug. Like it doesn't hold you in the right way, Yep. Because that usually makes them feel, postpartum especially, makes them feel less like they're like, I'm never going to get it back. Yeah. Like
it's going to come back.
And it could happen if you gain a lot of weight too. So like
also neglect during your postpartum time, right?
Yeah. So rebuilding that collagen tissue is what's most difficult or what's most challenging. Yeah.
I think dietary, we can talk about that as much as also dietary wise. So if you, you know, so for me, my perspective, so let me back up a little bit. So I really appreciated the way you described it, because maybe I shouldn't even say separated, because what I refer separation is the actual muscular tissue that is separating from each other, because not because there's a rip in between, right? But because they're really going away from each other, because it's thinning out so much. The actual, if you look at a picture of the abdomen, abdominal muscle, pictures of it, you'll see the white line in between, and that's the fascia, and that's the tendon, the collagen that you were talking about. But it thins out so much because of the relaxin and the stretching of the belly. It actually physically looks like the muscles are separating from each other.
And you're right, because we measure that. So if I'm measuring that in a patient's visit, so that's one of the things I always do postpartum as a screen. Just because people are asking about it, right? It's the most obvious. Like you can see your abdominal wall versus like your pelvic floor, your vagina, or your cervix, or urethra. You're not. I mean, you can't easily just see it. You gotta
you gotta get some good
move a minute. You gotta move a certain way. So when it comes to that being the most obvious concern for them, I definitely do that, like you said, and you do measure. So if my hands are my muscles and the space, I should do it like this, I guess. If my hands are the muscles and this white paper in between, it technically does
move away from each other,
get bigger. So that distance in between those 2 points. So we measure it by width of that tissue, and then when we measure it by depth. So how far your fingers can go in, and it's there's a lot of discussion on whether it's accurate because it's subjective. It's objective.
Do you have them crunch up a little bit? And then
I do, but just at base, those are the two types of things I'm looking at, data points of where. So to your point, that is separating. But I think we forget that there's something actually, because we're usually so concerned about the muscles.
Right. We don't talk about the fascia, the tendon, the ligaments. Those are really, really important as well.
They are.
Right.
Yes.
Because that's the integrity of the actual muscle tissue as well.
Yes.
Muscle is reactive.
Yes.
Right. Whereas ligaments are not going to be the reactive in the way that we think. They're still reacting, obviously. But ligaments don't like to be stretched.
Yeah,
they don't have the
past
same,
a certain point. They don't have the same makeup.
Exactly. They don't have the same elasticity or the integrity of the elasticity, right?
Yep.
Tendon a little bit better, obviously.
But just by nature of what the makeup is there. Yeah. And then, so like you said, okay, if that's what it is, if we understand the visual of it, where it lives, what it kind of does, factors usually are, well, okay, how do I prevent that? Can I prevent this?
Yeah.
Most of the time, I think because we notice that expansion during pregnancy, and so that's one of the few things that women are like, oh, I want to prevent. Most everything else, like, help me when I need the help. But in my opinion, it'll be interesting to hear what your thoughts are on this. Prevention, my goal for moms is actually not to prevent that from happening, because they have to have that expansion for their baby to grow.
Yep.
So I kind of immediately take that off the table in pregnancy.
That's like one thing off their shoulder or
exactly.
It's like, let's not worry about that.
You can monitor it and be like, oh wow, third trimester, like I'm about to give birth, and like I really noticed that. Okay, noted. I'll tell my I'll tell Dr. Kelsey, I'll tell Dr. Rhee, like, I'm noticing that, but I'm not gonna put pressure on you to change that.
Right. And I think I also see it in different body types.
Absolutely. Right? Genetics is a
big part of it.
I was going to say a different B word.
Yeah. Okay. So I don't know which B word that is, but it's a big part of it. Genetic makeup of your own body, but also we layer it with also environmental and dietary. So that's what I was going to talk about earlier. So environmentally and dietarily also, like if you are prone to having a lifestyle that's very inflammatory, and that's stress level, right? And then that stress can be a chemical stress through diet or environment, or it could also be a mental, like cortisol level, like high levels of cortisol as well in your system that is not tapering down, obviously, at a certain time of the day. And so when you have a high level of like stress in your system, I think that also, prones you to having more laxity in your joints, because if you look at even overweight people, right? So if we like to talk about just patients who are just really, really overweight, obese, their joint integrity is not the same than compared to someone who's not as overweight, right?
Yeah,
the load on that joint
feels different.
It feels very different
as far as like you reach a certain point, but it evolves over time, and so. It's interesting. That would be very interesting with which we have never up to this point been like, I'm going to throw out this research study because this is not what this space is usually for.
Yeah.
But it would be interesting to think about that in relation to what, because yes, we know it from a subjective or like anecdotal point.
Yep.
But how much of that is what we can control with the actual inflammation?
Yeah.
And when it comes to, okay, if we know that this is happening in pregnancy, and we both agreed relatively that we want to prioritize your passage through birth, and then we will support everything together. Yeah. In postpartum, usually I don't know if you have we're basically preventing it from getting worse. And so we're starting just from where are we right now? And we're just trying to start, because you're going to be activating those muscles newly or in a different way anyways. So I'm like, let's just try to start from where we're at and move forward with that confidence. It's nice kind of too with dietary things that you're starting, if you're nursing or if you're pumping, okay, what am I eating? How do I feel? How do I feel with milk? All those things factor into that.
Right.
So it's almost an easier, yes, it's overwhelming, but it's almost an easier time to take those things into consideration to support the rebuilding of that collagen.
Yeah.
Which just like collagen for like beauty aesthetics and that kind of thing.
I mean, you can take collagen in powder form.
That's what I mean.
That
it's
is
like
so
you
great.
can be building that up way easier than we used to be, because it comes in those specific
in the bottle now.
forms.
Yeah. I would actually combine, if we're talking dietary wise as well.
Yeah.
You know, I usually recommend collagen and creatine together as well.
Right.
Because the creatine is going to help build some of that muscle tissue in the cellular level, but also the collagen is the building block of that as well. So I like combining both in the dietary wise.
And if we have any kind of perineal trauma, that's going to be supportive. That protein. So those things all make sense as being like, okay, we're supporting, giving you the building blocks so that then you can actually utilize putting it together. The thing that I think is interesting that most people miss, I don't know, I've been so much in the population of women and children's health that I don't know what other people are doing that are, you know, seeing a random, like seeing a random pregnant person or postpartum person in their outpatient clinic and they see everybody. Like, I don't know what they're doing.
Yeah.
But when it comes to loading that tissue, so we basically give the building blocks to start putting those back together.
Right.
But now it's almost like you put paper mache on, or you put clay and you have to mold that. Yeah. Right. So
that takes a lot of active work.
Yes. So it takes the breath work from, like we were saying, the this is your tissue from the inside to expand that tissue, you know, all those things. Yeah. And then, like you said, it takes the pull from the muscles on the lateral side of that. And that's a bit why people are like, why are we practicing? Why do I have to care about my breath every time I do a rep? She's so scared.
So that takes me back to, from the type of work that I do as a chiropractor too. So obviously the physical aspect of the active work is really important, but it limits that. So talking about breath work, right? So when I do Webster, and that's another conversation that we should actually keep forgetting.
I know.
But the Webster part, you know, during the Webster session, again, my patients are not doing the active work. I'm doing the active work on them.
But you're setting them up.
But they're exactly. And I'm setting them up for it so during Webster, there's a lot of breath work that they have to do while I'm actually doing my work. So if they're not breathing correctly, I can't do the work that I'm trying to do.
Right.
All the soft tissue that I have to work on.
Because they're limited in that full expansion.
Yeah, the full expansion, exactly. And so then with that said, you know, neurologically, coming from a neurological perspective, same thing. When I check my mom, especially depending on the body type and how that baby is placing the weight on the mom's pelvis, right, as they're expanding, and not to mention if there's any kind of dysfunction or alignment problem or neurological. And when I say neurological, it can be anything, something really severe, like a full-blown like sciatica pain, to just like, oh yeah, I'm having a little bit of like mild constipation, and I can't hold my pee as long, and things like that. That could be a neurological as well, right? So that pressure that loads onto the pelvic floor neurologically, like all the nerves, all the sacral nerve, even into the lumbar, if those nerves, any of them are actually irritated, or if there are any like pressure building, right, then it's going to bring less neurological potential to all the abdominal muscles as well, along with the pelvic floor muscles, which is part of the core, right? And that can create that individual to be more prone for diastasis as well.
Yes. So what you're saying, which I agree with you on, is if you don't necessarily have in that core canister, if we don't necessarily have, if this is the front and this is the back, where the nerves are innervating and coming out. Correct. If we don't necessarily have the access of all those nerves
nerve
to
potentials,
the front,
yep.
nerve potentials. It's like that electricity is not being sent for that to fire to do what it needs to do. Which in the prenatal phase, because baby is there, maybe is an indicator for pain or discomfort. But in the postpartum phase, baby's not there anymore. And so, yes, it may feel less intense than it was, but it still probably is difficult to complete. So
it hits the wall for sure.
Yeah.
So like, let's say if I send a patient like that to you, and I'm not adjusting them and the nerves are not being addressed, those patients will hit a wall. Like they won't get to like 100%. They'll get to maybe 80 or 90%, and then like they're gonna feel a little frustrated. I'll tell you a story. Another this is actually in LA. Maple's old veterinarian technician, right? I saw her. My old dog passed away. Saw her. I was super depressed. She was depressed. Months later, maybe a year later, I finally went back for another checkup for Maple, and I see her, and I knew
the tech.
Okay. We've become good friends since then, but this is years ago. And I saw her when Honey passed away, and I knew she was pregnant. Then like a year or so later, I saw her and I thought, oh my God, when are you done? She was not pregnant.
Oh no, Justine, Doctor.
She just looked so pregnant. Like, I'm an expert in this. I know what a pregnant belly, like there's no.
Or you know,
I know. Yes. But I was just like so confused because like, I'm pretty sure she already must have had her baby.
Unless she's the longest.
Is she pregnant again? And so then I was like, I won't say her name because I love you. We're very good friends. We laugh about it all the time. But so she goes, oh no, this is diastasis. And I was like,
my life.
So she's like, don't feel bad,
yeah,
Justine, it's fine. I get it all the time. And I was like, oh my gosh, I want to help you. Can I help you? And we had another conversation. She became a patient.
Okay.
And so we had more conversations about that. And she really literally looked like she was 7-8 months pregnant.
So
because it was so severe and she neglected it.
Yeah.
And she had her baby at that point. I think her baby was probably like 2 years old.
Yeah.
So 2 years later, we're talking about that.
Yeah.
I think 2 or 3 years old, I think.
And yes. And when it comes to the, if we're saying like, okay, so you see her and she comes into, even though she's 2 years later, being able to have the function of those nerves communicating with each other in the front. And then one of the other missing pieces that happens a lot is it's similar to what you're saying, but it's a different tissue. So it's like different layers of the onion, is that it's easiest to use like a shirt, but I don't want to use my shirt.
What do you need, Doc?
I need like a trunk and a shirt, and I don't really want to use my.
I don't know if I can give you a trunk, but I can give you a shirt.
I'm going to sacrifice myself.
Okay.
So when it comes to, if we think about, so almost like a corset, and I even hesitate to use that because people are like, okay, yeah, I know it. I get that analogy, but if my tissue, I'm going to like really tighten up my shirt. If my tissue in the back, is really restricted.
Oh, I see where you're going. Yeah.
Then it doesn't necessarily matter how great my nerves are communicating. They could be 100%. Doesn't matter how great my genetics in the front of that tissue are. I could be breathing like an Olympian champ. If this is in the back is stuck, then I can't even
get a little bit
I can't even pull leverage. I can't even get leverage in the front.
Yeah.
So by even being able to expand a little bit in the front, you can actually
well, there's
pull
room.
and close.
There's room for those muscles to actually contract,
to react and pull and do something in all these different areas in the different directions that you needed to. And that's something that a lot of times, regardless of how far postpartum you are, people miss.
That's interesting that you say that, because that patient who became a patient, right? What does she deal with day to day at that point? Back pain probably all the time.
Yeah, and like so
because she has no core to stabilize her back.
Right. And so like I would, so if, I didn't know her, knew you guys know her, but like she was seeing you for that support, neurology support. And so I would say, okay, let's work on soft tissue rolling, tissue rolling, supporting the expansion through breath on your belly, expanding into your back, so that when you're like, I'm going to close this, and I'm exhaling and bringing that in, you have the ability to do it. So that you get the full circle. And that's usually why like working together is really important for people. Yeah. And also, you know, seeing someone who's in that specialty population. Because I learned that faster probably because I was working. I really had that question. I got the question a lot about DR. I was curious about that. If I was seeing 20 other diagnoses in a clinic that saw everyone from an infant to an 80-year-old, I would not have made that fast of a progression to say, this is how I'm going to treat this. I see. Which is also why I like to talk about diastasis or DR, because I'm like, people don't, but they can tell when they get, it's also a quick win for people to be like, oh, if you work on this for 10 minutes and then I try again, I'm like, oh, I can kind of feel, you know, I feel that's happening. And I'm like, okay, so take that. We're going to expand on that and imagine how that can work if you do it all the time.
How long does it take for, I mean, again, muscle mass, or I guess maybe that's not even the best way to ask that question because everybody is at a different stage of healing when it comes to diastasis. Like, I feel like some don't have that integrity lost as much, and some will really, and again, body type too, so
that's a good like, maybe if we do a part 2 on that question of like how long it takes, I'll look up some, because people ask me that. Usually I say it really depends. I would want, we can get the activation within 3 to 4 visits. But if you're also someone who's like, I only want to see you once a month, that's 3 to 4 months. Correct. If you're someone who I want to see you once a week,
compliance, man,
that's 3 to 4 weeks.
Compliance.
That's 1 month. It's just different. But usually we can get that activation to be happening and consistently staying. The other thing that's so interesting about DR, which is why like we'll probably do a part 2, like you said with dietary and digestion, you could have the tissue be intact and not significantly, we repair that tissue, we repair it, it's doing what it's supposed to do, it's holding things back, you're doing all the crunches, you're not seeing it come up, blah blah blah, and you could have bowel, like not impaction but constipation that is adding into it whatever is pushing forward. You could have cortisol, perimenopause to menopausal changes that is adding onto abdominal adipose that is like out of your, feels a little bit out of your control. I know that. I know that too. I don't know what's happening. So what I'm saying is like, I always try to educate them, like, look at what your tissue is doing. Is your tissue doing what it's supposed to do? You may have a different abdominal belly now in this time because of various things. Not that it can't change, but it could be an internal issue. Not just a muscle and the superficial. The tissue and the muscle working together. Which
it's all a dynamic within itself. It's a giant balloon inside.
So I try to exactly. So I try to remind them, like, that person you see on the internet, who knows what their pooping's like? Who knows where they are hormonally? Like I don't know. They could have a completely different. So not to say like don't try this, but understand if you have a functioning DR, then okay, take that with you. Like you did your work, take that with you to the next question. And that's even why asking us those questions is important. Because we can pull that out and be like, okay, we're checking that off. It is what it is. Maybe we need to look at something else now. So they're not just feeling like they're spinning. Well, more than we need to.
Exactly. Well, that was a great conversation.
That was good. That was easy to be a long one. That's hard, but we'll probably do more on that.
I mean, there's so much more we can talk about diastasis, but all right. Well, thank you for the conversation.
Thank you. Thanks, Maple, for being the unintended model. She's like, now I need to rest. Don't touch me.
Yeah. She was like kissing me. She was licking on me earlier.
Aww.
So,
And we will see you guys
on the next one.